Heart attack. The Women's Health Initiative, which was now a good 8-10 years ago, scared millions of women away and doctors away from doing menopause management. After that came out and said that if you take hormones, you're going to have a higher chance of a heart attack. That's what the study seemed to say. Since then, they've analyzed and reanalyzed the data over and over. They've kicked the statistics to death until they finally revealed what we wanted it to say. That if you do hormone replacement between 50 and 59, it doesn't increase the risk of heart attack, and in fact, it may even reduce the risk for some women. And there's conflicting evidence on that. So unless you actually have had a heart attack or have narrowed arteries, proven, have coronary artery disease, do not fear hormone replacement therapy. This is your regular cycles, then they go wacky, then they drop off, then they give a final spurt or 3, and then they die. The ovaries then finally kick the bucket and stop producing estrogen. And these fluctuations are what really drive you crazy. They drive us men crazy as well, but I can assure you they will drive you guys crazier. Estrogen works almost in every organ of the body. I won't go through them all, but it's not just the hot flushes. Estrogen is working on the brain, it's working on the heart and liver, the bones, of course, the breasts, and especially the vagina, the vaginal wall. Where does it work? Estrogen and testosterone work the most, and this is a lesser known symptom of menopause, shedding of hair. It's not one that we speak about very often, and it's a little bit distressing, but let's see the connection. Yes, we know that that hair loss is related to the ratio of estrogen to testosterone, male to female. It doesn't, however, mean that if you're losing the hair on top of your head, you're going to become incredibly butch and turn into a man. That's not going to happen. But it's certainly the ratio in your own follicles and how sensitive your follicles are. You would think that I have too much testosterone based on my follicular challenge, shall we say, otherwise known as baldness, but it's actually not. It's not too much testosterone. It's these hair follicles are oversensitive to the type of testosterone that causes baldness. And that's exactly what happens in all of your hairs as well, except you won't have the receding gently, not so gentle in my case, but that receding backwards and backwards. You'll have the overall thinning at the top until, as most of our grannies were eventually quite almost bald, eventually, for some of you, it thins at the top, but not everybody.